Welcome to PAC Forth, the official podcast of the Physician Association of California. We're here to protect the future of private practice. This show is for independent physicians, policymakers, and patients. Really anyone who cares about high-quality healthcare. We explore the issues shaping independent medicine in California, from policy debates to office administration and innovation. Let's dive in.
Hello, everyone. Thank you so much for tuning in to the first episode of PAC Forth podcasts. My name is Matt Robinson, the CEO of the Physician Association of California. I'm so pumped for this, very excited. First time ever doing this, but I'm ready to get right into this. But right now, I want to introduce our co-host here.
Hey, Matt. Great to see you.
Hey, Alan. Alan was just a natural fit for this. Been on radio, NPR, did podcast, done interviews, so super pumped to have you. Thank you so much for being a part of this.
Oh, I couldn't be more excited, Matt. Tell me a little bit about this podcast. What was the thinking behind it, and how did it come together?
A lot of discussion with the board of the Physician Association of California, myself, a new trade association, trying to do new things, trying to get a little edgy, trying to relate to our members, trying to relate to the audience, telling our story, education, and so forth. Probably one of the toughest things was actually coming up with a name, PAC Forth. We were Googling different things. There's a lot of different things that I wanted, different things that the team wanted. A lot of the names were taken. Kind of wanted the intro music to have some either Eminem or Lil Wayne in it. Was told that's a little too pricey. But I'm super pumped to have it, and super pumped for our first guest. And I know the audience is going to love to hear about him.
Dr. Omer Deen is the chair of the PAC Board of Directors. He's a nationally recognized expert in clinical nutrition. He practices full-time with the Deen Medical Group in Torrance, California. Dr. Deen, welcome to PAC Forth.
Thank you, guys. Thank you for having me. It's a pleasure to be here.
Let's start by getting a little more about you. I'm curious, what led you into medicine in the first place? You've trained at some top programs in the country: Ross University for medical school, University of Nevada, Reno for residency, and Cleveland Clinic for fellowship in digestive disease and clinical nutrition. But now you've made your home here in California, and I'm curious, why California?
I wish I had a philosophical answer for you, but honestly, after living in Cleveland all that time and dealing with Cleveland winters, I just looked at a map, looked at Southern California, and I was like, sunshine, warm weather, it has to happen. I've got to go live in sunny California. So that's what it was.
So when you came out to Southern California, did you know what you were going to be doing with? We're going to start your own practice. We're going to go work with another system. What got you into private practice?
I have always been interested. I kind of always envisioned myself being in private practice. So I come from a family where we've got a lot of physicians across 3 generations. And I kind of grew up exposed to medicine and healthcare, and especially back as a child, most everybody in medicine was in private practice in my family. And so I just saw myself doing that, and I always kind of envisioned private practice. I did enjoy teaching a lot throughout my career, but I knew that at least part of my practice was going to be private practice. And coming out to California, it's a funny story. I didn't actually have a job lined up. I had nothing lined up. I came out here, I had 2 young kids. I enrolled them in school. I literally picked a place in Seal Beach, for those of you who know, in Southern California.
Place.
Yeah.
Not a bad place.
It's a nice place, but they had a school there that was a nationally recognized elementary school. And I thought, you know what, this would be great. Came out, rented a 2-bedroom apartment close to the water, enrolled the kids in school, and then I spent a couple weeks kind of sitting around thinking about what I want to do with my life. And I should probably get a job to pay for rent next month. And so that's how it all started.
You didn't start surfing professionally?
No.
Oh.
I wish I would have.
Well, it's interesting because we've talked about this, numerous times, and we've had a lot of great conversations, you and other board members. Private practice is tough. I think I've in the recent numbers I've seen, especially here in California, about 33% of the physician population is now just upwards of maybe like 33%. And there's a little give and take there, a little delta. But I mean, 10 years ago, and this just wasn't just because of the COVID pandemic, but 10 years ago, I mean, that number was close to maybe 50% of those within private practice. And you're always, hearing, different things, pain points, reimbursement and so forth. But I mean, you're still in private practice. You came out here really, you had a goal, you had a plan, but you started, and I know you've been through like some troubles here and there, but you've been very successful. I mean, what's really kept you staying within private practice when, there may be some other opportunities elsewhere?
That's a good question. I think just generally, I think there needs to be diversity, and there are employed positions, there's teaching, there's private practice, there's different modes of practice. And a lot of people naturally gravitate to doing a little bit of different things. But I think what we're facing now is a time where people are being discouraged from going into private practice. And I think that's what's really tragic about current healthcare. Lots of reasons for it. For me, the autonomy of being able to treat patients the way I'd like, to be able to form a relationship with patients, decide how best to treat them or what will work with certain people. I like to be able to kind of have that flexibility and be able to pivot. Which is not to say that if you're in an employed practice that you're just not able to do those things. But a lot of times there's a lot of obstacles in the way. The choice of whether you want to charge somebody to see them. Do I want to see a patient? Do I want to see a homeless man for free? Or do I want to have a part of my clinic or practice be charitable? That's not something you can really decide if you're in an employed position. So that's a part of it. Also, as an organization, as most people will tell you, CEOs will tell you, to really make change is sometimes it's really difficult to steer a ship in a different direction. Whereas when you're in private practice, you're more nimble. You can make a decision at breakfast, and by lunchtime, you've changed your policy. You can do things like that. So I kind of enjoy that. And just having the ability to kind of establish a relationship with patients. If their insurance changes, if other things change, I will do my best to try to continue to work with them or see them. Whereas a lot of times in bigger institutions, you're kind of limited to, if you're within a certain insurance payer mix or whatever, you're in our practice. And if you're not, you got to find somebody else.
You mentioned that people are being discouraged. People are discouraged from entering private practice. What's a primary reason why, and who's doing the discouraging?
So multifactorial. The main, if I was going to drive, one point would be reimbursement. So declining reimbursements.
Can you walk us through what that means?
So insurance companies reimburse or pay providers for your time and expertise in taking care of patients. What's happened over the years is they've whittled away at that number, and I think a lot of times people don't understand how drastic that's been. So as an example, Medicare's fee schedule in 1981 was more than 3 times what it is today. So our current Medicare pay rate is less than a third of what it was in 1981. That's not accounting for inflation, that's dollar for dollar. So for every $100 that you'd make in 1981, that is now under $30. And that's huge. Now, when you take into account real estate is up, cost of living is up, overhead, minimum wage, all of these things are rising. So what's happened over the years is that doctors, and much of this I can speak to just from my own family's experience, we would just start adding more patients to try to offset that. Oh my gosh, I got to add 5 more patients, got to add 10 more patients. So it used to be where doctors were seeing 10 or 11 patients a day in a regular practice, spending half an hour, 40 minutes with a patient. Now most doctors are seeing in excess of 30 patients a day. And so you don't have that time to spend with patients. You don't have that time to establish a relationship. Also more room for error, right? If you're seeing patients in a rushed manner, you're going to skip things, you're going to miss things, and even if you don't make a mistake, the anxiety and the mental stress from the possibility of doing that, right? Like driving down the road at 35 miles an hour versus 120 miles an hour, there's a different level of attention required and region for error.
Well, you're talking about this giant mismatch between what's going on in the communities, between patients and their private practice physicians, and what's going on in Sacramento policymaking. And I'm curious, I'd love to hear from both of you, what does PAC need to do? What is, beyond just the mission statement, what absolutely needs to happen here in Sacramento for this venture, for the Physician Association of California to be successful?
Well, that's a good question.
Well, I mean, a very good question, Alan. And, I was very excited when I was approached by the board with this opportunity to start this trade association. Starting a trade association, especially in California, here in Sacramento, it's rare. It doesn't really happen much. However, I knew with my team of consultants and so forth, like there was a niche. And you're hearing from the passion from someone like Dr. Deen right now. There's a niche as far as like this voice needs to start being heard. Like it needs to be elevated. As Dr. Deen is saying right now, there is significant differences in burdens, but also benefits between someone who's a primary care physician who's in private practice versus someone who's a primary care physician who's in a larger health system. Much different issues every single day. Now, they're still treating patients all within the house of medicine, which is excellent. However, we need to start addressing those specific issues. And there's a lot of associations, other groups, specialties, and so forth that have been around for years. Well over 150 years for some of them. However, there was not one particular group that was saying, hey, we need to look specifically on what matters to independent physicians themselves. And before we launched PAC, in fact, we just hit our 2-year mark, our 2-year anniversary, which we're very proud of. Before we launched this, we built this from the ground up. We did focus groups in Sacramento, the Bay Area, Southern California, and it was listening to those independent physicians as far as, hey, what drives you? What are your pain points? What do you think of current associations or societies? What do you want to see in it? And we literally built this from the physician's voice. And that is also what is going to be needed. People like Dr. Deen, other board members, other leaders we have on our committees, where they also have to be active and let them know, hey, we have a platform now. We have a platform where we have something within our mission, within our pillars, where we are specifically advocating for things that matter to you most. And it is the reimbursement. It is the administrative burdens. It is dealing with things as far as how cost of living is going up. They're small business owners too. They have employees. They have to pay their wages. They love their employees. But there's a lot of things that go on in that. The liability. Just frivolous lawsuits. So there's a lot of things that we can address, and that's what we're trying to do. And we have been successful in it so far, which we're very proud of. But it takes people like Dr. Deen, to really stand up, use the microphone, and really fight for that mode of practice.
Dr. Deen, what has to happen?
Yeah, I think number one is just people need to understand some of the differentials between large group practice and independent private practice, the pros and the cons, but also why things are driven the way they are. The way our politics work, it's all about money. It's all about lobbying. And so you're seeing that the large groups and the insurance companies and the pharmaceutical companies, they have the money to be able to lobby. So they lobby. I don't fault them for it necessarily. That's the way things work. But who doesn't have the lobbying money? That's us. And so when you don't have it, your voice is diminished and you're not able to kind of affect change in the things that you want. So I think generally getting the word out there, not just amongst physicians, but amongst the public. And I think over time, it's happening involuntarily that patients are getting frustrated because they're not getting the level of care they would like. Medical debt is a big issue where patients are going into debt. I think, did I hear this right, that it's the number one cause of debt now? Medical debt. Somebody gets sick. That's horrible in the United States, So as this happens, there's going to be more frustration amongst the public, and I think that will bring the attention to this issue.
PAC had an important year in 2025. You passed your major maiden legislation, AB 1041. Matt, can you tell us a little bit about what that bill did? And then Dr. Deen, I'd love to hear what it means for you as a private practice physician and your hope for what it means for other physicians across the state. But first off, what was 1041?
So AB 1041, which was authored by Assembly Member Steve Bennett, was something that, again, just passed this last September and signed into law by Governor Newsom, is now going to streamline the provider credentialing process as it relates to those credentialing applications and processes through commercial health plans. So that law will go in effect in January of 2027. With it being streamlined within 90 days. And then, the CAQH application and that portal that must be used will go in effect of January 2028. It was an important step for us. Again, it was our first piece, our first actual full legislative year in our sponsored legislation, and we're very thankful and grateful we had it signed.
Dr. Deen, what does this new law mean to you as a physician and most importantly to your patients?
It's huge. First of all, I'm super proud of it. I'm grateful to Assemblymember Bennett for working with us on this. But just to kind of, to take a step back, what this addresses is, as a provider, as an independent provider, when I first started my practice, I needed to credential with all the various different insurances in the area. If I'm out of network, I am not contracted with them with any specific rate or even a guarantee that I will get reimbursed. And as a provider, that's not made evident to me until way after the fact. So I might see a patient today and then submit a bill for it and be like, you're not credentialed with us, so we don't have to pay you. I'm like, yeah, but I already saw them and treated them and did everything. It doesn't matter. What it has been up until now is almost every insurance company has their own application process, their own application system. They may or may not be accessible if I have questions, and they'll take their sweet time. Not everybody, but a lot of them will kind of drag it out to months and months and months go by. And in the meanwhile, I'm sitting here twiddling my thumbs, like, when am I going to be able to see these patients? But in the meanwhile, more importantly, patients aren't getting care by local doctors. They end up getting scattered and driven in other directions. And so down the road, a year from now, when I do get credentialed, now I got to go back out and fight for these patients that are already seeing other people right? So it really impacts business. It really impacts your practice, and there's no clear timeline. And so what this bill does is, it streamlines to just one form and one process that everybody uses, which is fantastic, makes it much easier. Secondly, it mandates a 90-day limit, so you can't drag this out forever and ever. Within 90 days, you're credentialed, or at least address the issues or the reasons why you're not that you have to address, or it's an automatic. So it really is going to make a big difference to independent private practice.
And to the patient too, because
Absolutely.
I'm imagining that the person is either waiting for this process to occur, or like you said, they're going to someone else, but that's not the optimal person they wanted to see for their condition.
Exactly.
So you're a busy person, a family guy, someone who's a top-notch physician running a business. You balance and you give a lot, and I'm curious what increased participation means for a physician. What have you gotten out of your leadership role with PAC?
Honestly, it's been incredibly rewarding. It's more of, so when I set out to do this, I didn't realize or think about how much of a positive impact it would have on me personally. I looked at it as something that I'm doing to give back to, as we say, the house of medicine and to healthcare in general, and to improve the quality of care for patients. But what I have found in it is, it's incredibly rewarding to do this work. It's incredibly rewarding to meet with other physicians who are like-minded, to hear their struggles, to hear what they're going through, and feel like you've had an impact and been able to raise their voices as well. And frankly, when I first started out thinking about, this is just, something that a few doctors are dealing with, and then over time you realize that this is most doctors. We talk about the independent private doctors, but I can't tell you how many employed doctors or doctors in academics I've had conversations with that are dealing with a lot of these frustrations but don't really have an outlet for it.
Dr. Deen, again, thank you so much.
Thank you,
it's a
guys.
pleasure. Thank you so much for coming up.
Thank you.
All right.
Thank you, Dr.
Pleasure,
Deen.
guys. Thank you.